Hello, hello, hello. This is Tooth Be Told. This is Dr. Kyo Dumpert
This is Dr. Walter Aka,
Dr. Gary Dennis from the freezing tundra.
Houston,
of
Texas.
Houston.
Yeah, exactly. It's like 36 degrees. Don't listen to him.
You
He's
guys
gotten
had a
salted.
big pile up down there, didn't you? Lots of power
Yeah,
outages.
well, because people don't know how to drive when any kind of precipitation touches the ground. It's ridiculous.
And our guest today is.
Oh, I'm sorry. Yes.
Our guest today
Dr.
is Gabe.
Gabriel Proulx.
Yeah.
Yeah, Dr. Gabriel Proulx.
So I went to dental school with Gabe. He was in my class, and he's tell us a little bit about yourself, where you're at today, and we're here to talk about teledentistry.
Sure. So I'm a general dentist. I was in Kyle's class. Remember you, Walter, somewhat. I don't remember you, Gary. I didn't know too many of the endo residents, but so since I did a GPR over at Allegheny General, since the VA didn't let me in.
Oh, geez.
I have that same
issue. I did a GPR for a year, and then did National Health Service Corps scholarship through 2 years of dental school, and then transitioned to loan repayment. So I've been at a community health center since then, just working in public health, community health.
Awesome. And how do you like that practice setting?
So it's got its pros and cons. On the one hand, it's nice that I don't have to worry about production, and like I don't have to feel like I have to sell treatment. And it's funny too when patients try to accuse me of like over treating, or rarely you'll get a patient you're like, oh, my last dentist didn't say any of those. It doesn't matter to me like whether you get the crowns that or not. So it's nice to be able to not have to worry about that aspect of thing. And it's a pretty good, they've given me a fair amount of autonomy in terms of doing the procedures I want to do. New York's pretty generous in their adult Medicaid. So that was also something I looked at, try to find a place that I was still able to do some root canal treatment, crowns, partials, dentures. And so overall, I obviously trade off some of the benefits, I think, of being able to have a say in who gets hired, fired, how things go. But on the other hand, I don't have that stress of having to deal with those things as well. So.
Now, you mentioned the National Health Service Corps. Is that the program that after 10 years you get your loans forgiven?
No, that's public service loan forgiveness.
Okay.
So National Health Service Corps is pretty similar to like the military scholarships, where you get a stipend, not as much, but you get a stipend in dental school. You have to commit to like primary care, which is like pediatric, I guess public health, general dentistry. I think those are the specialties, the areas that you can practice in. But you get a stipend in dental school, and they pay for all your tuition, instruments, all that. And then you commit year to year for payback, similar to the military. So I guess the military, you can specialize, to my understanding, you get more of a stipend. But so it was I didn't want to commit for all 4 years because I wasn't sure if I wanted to specialize or not. But it was nice to be able to have the option to transition into loan repayment afterwards, which isn't you don't get as much for that because it's after the fact, but it was also a good scenario.
Mm-hmm.
So do you see yourself staying in that position where you're at?
So
long term?
So I gave notice a few weeks ago. I'm going to be going on paternity leave, and then
congratulations.
Thanks. We're going to do some traveling too, so I'm going to live a little bit of a nomadic life for a bit, and then figure out somewhere to settle down and figure out what private practice, academic. I also have a background. My undergrad was in bioinformatics and computer science, and so I've got a lot of interest in helping kind of shape how dental software works, how it's made, giving that clinical perspective, because I don't think there's a lot being given or considered from like the clinical side of things when they develop software. So currently I do this kind of transition to teledentistry is I am doing some consulting from like a clinical perspective for a teledentistry company, as well as doing some teledentistry consults as well. Not many, but so yeah, I have interest in being more involved in helping some of the software get developed so it works for clinical workflows better than what there currently is out there.
All right,
Now,
so
before-
what exactly is teledentistry?
So
Just jump
I
right
guess
in.
what are your like thoughts and understanding? I'm curious to hear before I share my, especially
Well-
given 2020.
My personal view on teledentistry is that it's completely ridiculous. And it's like similar to Smile Direct Club.
Okay. All right. Well,
As
you
far
got to
as
go
the
more
amount
depth.
of how ridiculous.
You
Well,
got to go
because-
more depth. Explain.
All right, so when I think of dentistry, I think of cleanings, keep your teeth clean. I think of decay removal, and anything that becomes more advanced. So if you're not actually cleaning a tooth or removing decay, to me, it's not really considered dentistry unless you're doing dental public health.
Okay. So you're gathering data. Is what you're saying. If you're gathering data, then you're dental public health. Anything
Or-
else is dentistry.
Or like setting community guidelines.
Okay.
Other than that, like to me, it's not dentistry. Like I
Okay.
don't even consider orthodontics dentistry, and they're not even, they're not clean. They're not like they're just putting in some little brackets and movements. They're not really.
Yeah.
Their assistants are doing all the work. Like
Right.
yeah.
That is true. That is
Yeah.
true. But I will say for teledentistry, when I think of that, I'm thinking what telemedicine is, right? Telemedicine is, and I actually had to do this for, I think it was maybe last summer when an assistant got exposed to COVID. So therefore, I had to go through. You guys know the whole chain. If you're anywhere near somebody within 10 feet of someone breathing on you, you have to go through the whole chain of getting COVID tested. And I called my primary care to get the test, and she was like, "Oh well, I got to do a telemedicine first." And all that consisted of was getting online with her, FaceTiming or whatever whatever like this, and then telling her my symptoms, which were nothing, going over all this, and then she had my information in front of her, and then she was like, "Okay, well, come in."
But the
So
difference,
Go ahead.
I say the difference is that when you go to see your primary care physician, most of the time they're not doing any procedures on you.
Right, and that's what I was getting
checking
at.
the labs,
Yeah.
looking at the
Right,
reading
and
the data, and then like giving you some medication. But when you go
Well,
see your dentist,
Yeah.
they're actually performing procedures on you.
Well, so that's what I was getting at, Gary. Was like basically to me, teledentistry is just consultations, right? The only difference is what I find to be difficult would be you would need to have X-rays, and then we would need to be able to see inside the patient's mouth, and that's the part that I think teledentistry would kind of fall short, because dentistry we actually have to get hands-on. So tell me, like, if I'm
Probing,
wrong. Yes, exactly.
clinical
exactly.
testing, like,
Right.
all those
And that's why I don't understand how teledentistry could exist, because of the fact that we have to do the hands-on part with our consultation.
we only have subjective findings. There's no radiographic,
Right.
no objective, clinical. Like there's like
But-
2/3 of the data is missing.
And that's why Gabe is here. So
Yeah.
he's going to educate us and let us know.
What about you? What about you, Kyle?
So my first experience with teledentistry was, again, when the pandemic hit, and the consulting company that I work with or hire, they started to really push teledentistry, and I was trying to figure out how to incorporate this technology into the practice, because I've added a bunch of other different technology companies, Dental Intel and others that I tried paperless forms, iPads, that kind of thing. I have an older population, so that didn't work. And when it came to teledentistry, I think it came down to one. I see the benefit when it comes to consults, because in a small town, um, or in a big city rather, if you have a question or a concern like you would a physician, you can get online, schedule an appointment, a telemedicine appointment, and it's a little bit easier to get that appointment taken care of, where you're not taking up expensive chair time. You can set aside, maybe in the afternoon, or delegate that responsibility out to somebody else, have it recorded that you can answer it whenever is more convenient for you. So I understood that aspect of it. And as telemedicine grew, and I saw that specifically the elderly population was able to log into their iPads or whatever and use that technology, it started to make a little bit more sense to me. But that's a very small portion of my patients that I could actually accomplish anything with, because rarely does somebody come in and tell me exactly what tooth is the issue. This is just give me an antibiotic right now and we'll get everything scheduled. Usually there's, like Gary said, there's a lot of testing involved. There's x-rays involved to figure out what the actual problem is. And that's the part I also struggle with teledentistry. The other exposure I had to it was I use ClearCorrect for orthodontics, and they came out with a program that you can virtually track tooth movement. So it's an app the patient downloads as they're wearing the trays. They hold their cell phone up and they follow the app's instructions on scanning their own teeth, and they don't have to come in for those monthly visits because everything is being tracked virtually. So those two, consultations and orthodontics, I see as potential, but those are the limitations I see, and that's kind of where I'm stuck and haven't implemented any form of teledentistry in the practice.
And then also in Texas, they weren't paying for teledentistry. Mm-hmm. That was another thing too.
Well, yeah, Texas is actually
the Wild Wild West.
I think to the last. And I have something down that I've got jotted down that I'd be interested in discussing about Texas, and I think there's a couple other states where it's technically not legal, at least according to the Dental Act. But yeah, so I mean, teledentistry. It's kind of weird because I think teledentistry is kind of an odd term. And I effectively, I don't know that it'll be around so long being referred to as teledentistry. Because I mean, you think about friendships, we don't talk about like telefriendships or like telesocializing to refer to like Facebook or texting. And so really, I think it's just a part of like dentistry, doing dentistry. A lot of it does, a lot of dentistry does happen and has to happen in your dental chair. But there's a lot of, quote unquote teledentistry that's, that we already do handle over the phone, that we could do over video. And that's kind of what people think, a lot when they hear teledentistry is video, which I think has a lot of limitations. But there's also, messaging patients, having them send you a photo to assess things. And then technically it does, under teledentistry, there's also like connected devices and like patient education and stuff. There's a few different like modalities that they have defined. But so really, I think it's just part of dentistry in general, and it's going to become more that way in the next few years. But I think it's just another tool in the toolbox. There were done a few things that, because I had a lot of these same kind of concerns and kind of misunderstandings or overall concerns about teledentistry. And I think one of the big ones is that it's replacing an in-office visit. And so, when you're thinking about teledentistry as a dentist, you think about a lot of the things that you do. I can't drill a tooth, I can't put a filling in, I can't extract a tooth, I can't measure perio or vitality test over the phone or over video. But you're really not necessarily trying to replace a visit. In some instances, you are going to replace like a follow-up that you really may not need to have in the office. Other times, it'll help you realize when a visit is needed that you maybe wouldn't have otherwise. You know, if somebody has some swelling, everybody's way of describing their swelling is different or their symptoms. And so if you get a photo and you see, oh yeah, that's something you either need to come to the office like right away, or we need to send you to the oral surgeon. But a lot of times it's just going to help you schedule more efficiently. You know, whether you're going to now schedule 15 minutes to smooth off a chip versus an hour to do a crown prep. I think the other concern people have is that it's limited in what you can do. And again, it's really not about like performing treatment over the phone or over video, but a lot of what we do as dentists is, does involve triaging, kind of assessing severity, treatment planning, resolving concerns with patients, building connections with patients, and a lot of that you can do in the teledentistry setting, regardless of what modality. Another concern, that people had is like the liability. I talked to a lot of dentists about it, kind of understanding their workflow and answering their questions. And one thing that they ask a lot is like, well, what if I miss something on a photo, which is kind of an interesting concern because, I think we're a lot more liable for all the radiographs that we take. And it's the same thing, like you may miss stuff on a radiograph, but you just kind of have to adapt to trying to be comprehensive in evaluating things. And then I think what the main other one is just like the reimbursement side of things. Like on the one hand, it's interesting because dentists complain a lot about not being paid for our time outside of a visit. And, rightfully so, want to be reimbursed for all the work that you do outside of just doing these billable procedures. But then there, especially with this last year, there's a lot of complaints about this kind of rush for a lot of people to, bill for a phone call where they send an antibiotic when they were already doing that anyway. And so I think there's some valid kind of concern about, trying not to just like nickel and dime your patients.
So wait a minute, you said that dentists were billing patients for a phone call?
Well, that's teledentistry, telemedicine.
So I think that's one of the perceptions of like on these Facebook groups is, as soon as the, COVID hit, there's a lockdown and there's this push, maybe by consulting companies or by other people to like, oh, now you need to do teledentistry. Like you call somebody and talk to them for a few minutes instead of the antibiotic. Like you need to bill them for that, which, again, it's not always about necessarily making more production. Sometimes it just is about treating the patient better and maybe not bringing him in every time you need to see him in the office.
And that's what I built out one teledentistry code throughout the whole pandemic. And I read the rules from the insurance company because the insurance company sent an email saying they were going to start reimbursing for it. They wanted documentation. So whether it's a photo, a recorded video call, something along those lines. So there was an emergency. The patient, I said, text me your picture. They sent the picture to me. I added it to their chart. I'm talking to the patient and sent it out as a teledentistry code. And I did get paid for it. I don't remember how much. It was probably some small amount, but it counted. Most insurance companies in my area anyway, I think it's the same national, but they cover 2 exams a year. And that teledentistry code burned one of their exam codes or one of their exam allowances. And whenever I saw that, I instantly felt really bad because now this patient's going to be upset when they come in for their 6-month checkup and, one of them's not going to be covered now and they're going to have to pay out of pocket. And, oh, Dr. Dumpert charged me for that text message that I sent him. And in a small town that can get around quick. So, my cell phone number's on my answering machine. Patients can call me anytime, day or night. They know how to get a hold of me. And unless insurance companies start reimbursing for that separate outside those 2 exams, I look at it as x-rays. Whenever x-rays first came about, insurance companies didn't pay for them. Dentists really didn't have them in their office. But once insurance companies started to reimburse for x-rays, all the dentists got X-ray equipment in their office and started billing out for it. So I think a barrier is that insurance. I don't know if you're going to have a lot of happy patients paying out of pocket for a text message or phone call or video chat with the doctor unless that's an added value they're getting out of their insurance.
Yeah, I think. Go ahead, Walter.
No, please.
So I was going to say, I think I've read through, because the ADA has a sheet that goes over a lot of insurances of like what they do cover and don't cover and the limitations. I don't know the specifics, but I'd be curious as to whether that, whether they lump all exams in, or I thought a lot of insurances had an allowance for limited exams and then had allowance for like periodic or comprehensive exams. And I would hope that they would count that as one of the limiteds. So yeah, I mean, there is some, like, you got to inform the patient, give them a heads up. But I think that, yeah, one of the silver linings, I guess, of COVID is that there are a lot of insurances that are now reimbursing for it. And I think they'll come to see that it's a win-win-win in some situations where, like, if they can get patients to the dentist when it's a cavity, because maybe they've got dental anxiety or they don't feel like it's something that's important enough. But if they can get the patient to the dentist when it's a cavity, and you can do a filling instead of, before it's a root canal or a crown, and like that's a better service for the patient. And hopefully that's something that dentists are on board with too, and less expenditure for insurance. So I think it's getting there, but there's probably still a large ways to go.
So I guess I'm kind of confused still. And in my mind, I'm still thinking telemedicine, which is get on a call or a phone or whatever and tell your dentist what the problem is, right? But you're saying it's more like a all encompassing. Hey, I'm just hanging out. There's a problem. I call my dentist and I get put on the schedule to go to the office. Is that what we're going?
I mean, technically, teledentistry would be anything that happens outside of being in person with the dentist. So there's a bunch of different, and that's, I think, one of the interesting things about teledentistry is that when somebody brings it up, you think of like direct-to-consumer orthodontics, or you think of people just like billing for, a phone call to send a prescription for an antibiotic. But there's so much, encompassed in that. So there is the direct-to-consumer, like, specifically orthodontics. Or I actually listened to a CE the other week that was like not direct to consumer, but it was like teledentistry partials, which seemed a little interesting, I guess. There's also, teledentistry where you've got a nursing home or something, and you have your hygienist go in and take intraoral photos, and either in real time or asynchronously, the dentist reviews that. And again, maybe you're not catching everything through that visit, but you may kind of know where to schedule the patient better so that you're not having him come from the nursing home as many times, or going into a school where it's pretty remote. I'm in upstate New York, and we have hygienists that go into the school, and where there's really not many dentists around that participate. So that's another modality where you've got an assistant or a hygienist with the patient, and the dentist is offsite. But there's also, like messaging, video, photos with patients. And then there's technically connected toothbrushes, like if that's getting forwarded to the dentist, like that would fall under teledentistry. But they break it down between asynchronous, synchronous, and then they've got these two other, like remote patient monitoring and mobile health. So like asynchronous is what you think of, what you're thinking of, Walter, with telemedicine, is like you're in a video call and you're talking to the provider, they're talking to you. And that's where people usually go to and think about. But I think there's a lot of limitations. I think that's probably more useful maybe for specialists, if you can front load your consultation, and maybe if you have them take some high quality photos and you have the radiographs forwarded from the general dentist. Around here, a lot of the specialists do a consultation first, and then they'll bring the patient back for treatment and rarely do treatment on the first visit. So that's potentially a way, regardless of how much you're being reimbursed for the consultation, if you're able to bring the patient in and go directly to extracting those teeth instead of this extra appointment, I think that may help overall efficiency production and also be a service to the patient. But then there's asynchronous, which is not in real time. And I think there's a lot of, maybe a lot more benefit, especially for a general dentist with that, where, instead of this phone tag with the front desk and the front desk asking how big the swelling is, they can send you a photo, send you a message, and then you're able to respond back to it in your own time when you've got a cancellation, when you finish with an appointment earlier. And I think there's a lot more benefit that maybe isn't realized in that.
So basically you're saying it's more triage. I think you already said that, matter of fact.
So triage or following up. I've got a bunch of different use cases here that we can kind of go through, and I'm curious to ask you guys some questions about certain things that, as I thought through, I was like, oh yeah, that definitely would be something that I didn't need to bring the patient in for. But one of the things that as I got introduced to teledentistry and thought about it more, that was interesting is that it's such a big space, and it's easy to think of it as you're competing for the same slice of the pie, especially with this direct-to-consumer orthodontics. But I feel like in some ways you're actually bringing another pie to the table. You're increasing your access to patients. You might be able to attract more patients that, if you had a link on your website where they were able to take some photos and kind of get your thoughts before they came in for a new patient exam. And maybe you were able to ask them if they wanted to start treatment on something that you saw, and you were better able to schedule that. So I think that instead of just kind of cutting up, competing for the same patients, it does increase access and maybe brings more to the table overall.
It's interesting. You mentioned one thing in there that said that about getting a photograph and or an X-ray prior to the patient coming in. From all of my referring dentists, I always ask for them to send the most recent X-ray of the tooth. So I should be charging them for teledentistry.
Well, there technically is a code for consulting with another provider, but this would be the patient isn't sending you the photo or the radiograph. So I don't know that you'd be able to bill the other provider for that. But
no, I see
I
see the benefit there. Definitely, whenever I send patients to a specialist, the oral surgeon, the periodontist, there is that initial consult appointment. The endodontist, sometimes he does same day treatment. Sometimes it's just a referral or a consultation to bring them back. And especially for oral surgery, because it's a 6-month wait to get somebody in to see the oral surgeon, the patients are a little upset that the first time they go in, it's just a consultation, so they're still not getting that treatment done, and they have to go back again. So if there was better communication, better technology available for me to get all of those records that the oral surgeon needs, or any other specialist, as long as that specialist trusts my records and trusts my probing depths, trusts my x-rays, trusts my vitality tests and everything. But I think there's a legality issue there also, especially if I'm referring to Gary and I say, patient's having pain with number 19, and these are the results of my tests. And if Gary doesn't do his own testing and does a root canal on number 19 and turns out it's 18, now him and I are both liable for treating the wrong tooth because I just misdiagnosed and he trusted my misdiagnosis.
Well, that would be negligence on my part.
Right.
You should never trust someone else's testing if you're the one.
Well, but that's what That's what he's saying is that in the end, there has to be some kind of level of trust. If it's not you and the patient, it's you and the referring doctor. Mm-hmm. So there has to be a level of trust. So Gary's probably never going to do this because he doesn't trust anybody. It sounds like.
Well, I mean, it's CYA.
Right,
I mean,
exactly. But do you see what I'm saying? There has to be a level of trust.
How many quality referrals do you get? Where, like, whenever I refer to my endodontist, I try to say, you know, please eval number 19, cold negative, percussion positive. My diagnosis is necrotic with symptomatic apical periodontitis. I try to give all that information. Where
it
I, I,
depends.
I assume you're getting some things like pain
No,
lower right.
I'm getting root canal
Right.
number 18. That's it.
Yeah, I was
Yeah.
like, Kyle,
Nothing else.
that sounded so good, Kyle.
Yeah,
I've
there's
never
nothing
heard
else.
that. I have never
But
heard anybody give perio and endodontic diagnosis. That's
nonsense, right?
amazing. Yeah, they
But
usually
but
just say tooth hurts, do something about it, and I'm like, oh, good talk.
but like what you and Walter said, I mean, it has to do with the relationship I have with that dentist. Like if there's a dentist who, like every time they send me a case, 99% of the time it is that tooth, that's the one that needs treatment. It's restorable, like all that. Then, I already have that. I already trust their ability to diagnose appropriately. But if it's so I already know it's treatment. But if it's like someone else who I work with, and 50% of the time it's the wrong tooth, the tooth's not restorable, the tooth is normal, then I already know, like, this patient came from that doctor. We're gonna do a consult first.
Yeah,
So,
I think one of the things when it took me a while to wrap my head around teledentistry and like feel comfortable with it, and still in certain instances, like I'm still not sure what I think about that teledentistry partial thing, but it's not going to work in like every situation. That's one thing, I listen to these lectures about, in California where they had all these hygienists that were like doing the cleanings and taking the x-rays, and then the dentist was remotely doing the exams. And I kept thinking, like, well, you're not going to be able to like feel, this, I'm going to miss this and that. But then you can always bring the people in, if there is a question. So it's not going to fit for every patient or every situation. And again, if you're thinking of teledentistry as something like separate, it's harder to like get on board with that. But it's really, in the instances in which it saves you money, saves a patient time, saves you time, saves PPE, some instances it'll work really well. Other instances, yeah, you may still be seeing him in the office, but it may give you some more information to be more efficient about your visit. Other instances, it may take more time because now they've got another way to access you. But I think overall there is a benefit. It's just about figuring out how it works into your practice and treating
I see
patients.
the benefit for post-op. I see the benefit.
Yeah, I see. Here's something, Gabe. Dentists are telling by nature. They barely want to work. Okay?
Time out.
No. Let me finish what I'm getting at, right? Most dentists' ideal, and we had this discussion, is to work 3 days a week. 4 if you really want to push it, right? And now what you're telling me is I have to work not only my time where I scheduled at the office, now I have to go work outside of the office. How are dentists gonna like get on board with that? Because now you basically say patients and other dentists have access to you 24/7.
Well, again,
That's going to be hard for them.
It depends on how you set it up. Like you may not set up something where they can reach you out of hours.
Right.
But on the other hand, like I know you guys were talking about people blowing up your cell phones or like using the cell phone. If you were able to, have somebody, not have your cell phone number, but still have a way where they could, contact you and you were able to not get stuck on a phone call with them, or instead of asking them like, okay, well, how big is the swelling? Like, what exactly does the tooth look like? Like if you get a photo, I think it'll save you some time. Yeah, there may be some instances in which you might be a bit more accessible, but you'd have to see implementing in your office. But I think one thing that, for the most part, dentistry is like really synchronous. I mean, you're seeing a patient, you have to do dentistry. You have to have a patient in your chair to work on that. If they don't show up, or if it's a late cancel and they can't put somebody in that schedule, yeah, there's other stuff you can do, but not really get paid for or really move the needle on production. But if you've got some of these consultations where maybe you're getting paid for them, maybe you're not, or maybe they just help you schedule patients in for treatment or help new patients keep their appointments more. I think that if you had some of these asynchronous things where, yeah, you got a cancellation or a spot in your schedule, or you just opened up a practice so you do have more time. If you can start attracting these new patients and doing stuff, kind of fitting it in between, I think it could be a more effective use of your time, and you can be more productive during your day. So you can maybe work the 3 days instead of 4.
I think it would be beneficial if you can find somebody or have somebody in your office that could triage these pictures or emails or whatever, so that you kind of say, okay, well, this is more urgent, so that's going to go to Dr. Dumper, while this might just be a quick discussion or maybe a new patient that needs to come into the schedule. Does that make sense?
But what's the legality of that, though?
Right. But I'm not doing teledentistry. I'm just putting
your front desk is doing this already, right? I mean, you don't take all the phone calls for emergencies.
Right. Right.
So, because that's another thing that people say, like, oh, what's the legality of this, or like, what's the liability? But you're basically having, like, we don't license front desk people, but yet they're sitting on the phone determining whether they can schedule a patient tomorrow with a facial swelling versus like sending to the emergency room. So yeah, it's not a perfect system. In some ways, I think this may help with some of those instances and reduce your liability. But yeah, and it depends on how you want to set it up too. Some offices, the dentist may want to view things, or maybe that's too much. And this is just something that the front desk is, instead of being on the phone and listening to patients talk about how it's like 15 out of 10 pain and like this is what the tooth looks like, maybe they get a message and they're able to schedule from that, and it could make their lives easier, help you retain staff more.
I will say, go ahead.
Is this something that is being used with some states allow dental therapists, which there's not a dentist on site, but the dentist is available, I guess, for consultation, or the dental therapist can do limited treatments, fillings, and other types of easy extractions. Is this something that those states are using teledentistry for, to maybe enhance that that communication between an off-site dentist and an on-site dental therapist, or expanded function dental assistant, something along those lines?
Yeah, I don't know. I don't know the specifics, because I know like Alaska has dental therapists, and then is it Minnesota?
Minnesota, yeah.
Right.
Yeah, and I don't know whether those
Dakotas
do need oversight or not. But I mean, I'm sure it could, and maybe whether that allays some of the concerns of like organized dentistry, I kind of doubt it. But yeah.
What about security? Because I keep thinking someone's hacking into the system, right? No, seriously, every time I hear this, I'm thinking someone's hacking into the system. I mean, how do you make sure that we keep track of patients' like personal information, right?
Because that HIPAA fine is no joke. That is a big fine.
In general, I'm just talking about like just in general, like if it's an app, how do we make sure that it doesn't fall into someone's hand and someone isn't like, sending the wrong information to the dentist or whatever it may be? Like my daughter is on my phone looking at YouTube Kids or something and pushes the wrong button or something. How do you make sure that we keep all those security systems in check?
Yeah, I mean, certainly.
Without being annoying to the dentist. Like, for example, the e-prescription, it's incredibly annoying, right? We know this. No, for real, you guys laugh, but the e-prescription is incredibly annoying. So how do we make sure that we can use it?
And it's not fine with me.
Oh, Kyle, be quiet.
I don't use it. I don't know.
You see? So please talk about like security and how do we make sure the ease of use?
Yeah, I don't know the back, the ins and outs of HIPAA.
Yeah.
But I do know, like, I mean, it's possible there are better and worse, because telemedicine is doing this type of stuff, obviously, or medicine in general, not even just telemedicine, but being able to contact your doctor, ask for refills and stuff, and some of them are easier to use as a patient. Some of them are harder. I think that if you consider, because there are a lot of dentists that are doing quote unquote teledentistry now. I mean, I don't know if do you guys ever have anybody text you photos or text you about
all the time?
Mhm.
So, on the one hand, you're already doing teledentistry, and it's a pretty, it's not HIPAA compliant. And then you're also not documenting. If want to talk about liability, you're not documenting those
Everything.
text messages probably. And if you are, I heard somebody the other day saying like, well, sometimes I try to take screenshots of it. Well, technically, you're taking screenshots if you have an iPhone and you're syncing to the cloud. I mean, there's another like non-HIPAA compliant
Right.
hole in
Right.
it. So yeah, I don't know the ins and outs. I know it's possible, and that's kind of my interest as both somebody with a background in computer science and a clinician is like figuring out how to make software work easier because that's not really doesn't seem to be top of the priority list on a lot of the EHR
Can I
companies'
just say,
minds.
if you could find an app or a program that allows us to, the second I open it with a patient, it automatically gets like transcribed or whatever into my office, so that basically whatever I'm talking to or saying with the patient is also getting sent over to the office. I think that would be incredible, because then
So,
I don't have to go back and double dip. You know what I mean? I don't have to go back
Oh,
and
you're
write
saying when
another
you're
note.
calling a patient?
Yeah, if I'm calling a patient or whatever using this app, it automatically gets sent over. So now there's a record on that patient's chart. I think that would be incredible.
there kind of is
Okay.
like, I don't know if you, well, for endodontic software, there is like TDO.
Okay.
TDO is like on the cloud, right? So like you can look into patient's chart anywhere. You can send anything to any other dentist anywhere
Okay.
with that system. So there is kind of, I
Right.
mean,
But
as
I'm
far
talking about
as
like if you're the patient and I'm talking to you, whatever I'm saying to you after I'm done talking to you, it's done recording, it's sent to your chart.
it
I think that would
transcribes
be
it for you.
cool. Like transcribes it or sends it to the chart. So now there's an audio. So there's basically no issues. If a patient said, "Oh, you never said that," you have proof that you said that. Does that
Well,
make
I
Yeah,
sense?
think that's the
I
same
think one of
problem
the
we have
benefits.
now, isn't it? Like if we're doing an in-person exam on somebody, it can come back to he said this, she said that, especially
Well,
if
you
things go wrong. Our
right.
actual consultations in the operatory aren't being recorded.
Well, but there's always an assistant there, so you kind of have a backup, right? That's why I never
Okay.
do anything without
Okay.
somebody else in the
Yeah,
room.
that's true.
You see what I
That's
mean?
true.
So yeah.
I think with
And you are,
teledentistry, if you're able to handle some of these via like messages, via a photo, the nice thing about that is, if the software is done right,
Right.
you can just import that, or preferably not even
Send
need
it.
to import it, but like you already have everything that went
Right.
back and forth a photo,
Right.
and so hopefully that would reduce some of that burden because you're hopefully on the phone less, talking to these patients. But I put down a few of the. I mean, there's a lot of uses, and each time I kind of think about it, sometimes I'll uncover other different uses that I haven't thought of before. But I think overall, like the goal, there's a lot of goals. It's decreasing non-billable visits. Generally you're not charging for a follow-up visit. Sometimes you have to have them in person because you're taking out sutures or really do want to see what something looks like. Other times it's just to make sure the patient's all right. Increasing productivity, whether that means you're seeing more patients or you're being more efficient or productive during that visit, or better able to schedule how long that visit should be. I think you can improve patient care with it, um, certainly improve the patient experience, and then also increase access to care, depending on, which of these modalities you're talking about. I focus more on like what dentists are using, direct to their patients. I haven't delved into as much like the hygienist in the nursing home or that type of thing. But yeah, for follow-ups, if you can conduct a follow-up with a message, with the option for the patient to attach a photo instead of bringing them into the office, like triaging patients, if you had a link on your website or something that you could send to the patient, if they did have a concern, um, maybe they don't need a visit, or you're better able to schedule, again, whether it's 15, 20 minutes to smooth off a chip or an hour to prep a crown. For new patients too, I think this is probably a product of my generation, and me being an introvert, but I don't really like cold calling an office, trying to talk to the front desk. setting up an appointment. So if you had a way where you were able to attract patients, get some photos, maybe get them to start the paperwork, maybe you can give them, some thoughts at a time, see if they, whether it looks like they need treatment, whether they're open to starting treatment that first day, whether you want to schedule with the dentist or the hygienist first, get them bought into the practice, that relationship ahead of time. I think that would decrease no-show rates. Maybe reactivating patients, if you have an issue of patients that are, overdue, not coming back. And if you have hygienists with some free time, if you're able to reach out to some of these patients, touch base with them, have them take a photo of their gum line, maybe the linguals of the mandibular anteriors, have the hygienist kind of annotate some stuff, kind of help the patient realize why they should be in your office, while also using, again, their time that they may not have been doing anything. Following up with severe facial swelling after extraction, endo, or if you didn't do any treatment, but you just sent a prescription for an antibiotic. I mean, how do you follow up with that currently? Do you have the front desk call? Do you call? Is it easy to really assess how things are looking just over the phone, or you bring it back in? One thing for periodontists in particular, that I think I would be interested in is if you were able to send a message to, or schedule a message to be sent to a patient 6 months after an implant was placed, or like a year after a CT graft. Again, you're probably not going to bring the patient in just to see what the crown looks like, or to see what their graft looks like a year down the road. But I think it'd be interesting to be able to kind of add that personal touch that you're still kind of connecting with the patient, but also see what your work looks like and learn from that.
Right. To be honest with you, and with speaking of that, what I would actually do wouldn't be to send to the patient, but I would send a reminder to the general dentist to make sure the patient is on a 3-month recall for the first year, just based on literature, right? That says, hey, the first year is like usually the critical time. Get them on every 3 months to see how that, that implant looks, how that soft tissue looks. Do we have any issues so we can take care of, check occlusion? So maybe like an automatic send to the referring dentist, that's more beneficial to me. Mm-hmm. You know what I mean? Because then we can keep track of that, and then maybe the referring dentist can take a picture and send that to me, right? So that actually would be more beneficial than send to the patient. Patients to be like, the implant's fine, I love it. But the dentist can actually do more clinical evaluation for me than anything else.
I think it's kind of a similar issue. I was thinking the other day we were talking to an endodontist, but I don't know, Gary, how often do you have patients telling you that their cavit has fallen out, or that, it's 2-3 months down the road and they never went back to the general dentist? Like, if you could automate something to be sent, 3 weeks after the appointment, say, hey, just make sure you got in touch with your dentist to get the final restoration of the crown or whatnot. Or if you were able to tell them, no, your cavit is still in there, it's just kind of wearing away, without, guessing over the phone or bringing it back in.
Yeah, it happens. That's for sure. I was going to say that, when I came into this podcast today, I really thought that teledentistry was absolutely absurd. But after you have explained the application of teledentistry, I actually do see a benefit to it. So, good job.
This is a breakthrough. You've done something that I don't think anybody has been able to do. It usually takes a few years to get Gary to admit to changing his mind about something. You, sir, have done wonderful. Come on, anytime you want. Anytime you want. You can come back to the podcast anytime you want.
So I did have some questions for you guys, like your follow-ups. How often do you guys do follow-ups, and are there instances in which you are bringing them back, you don't have to do anything, but it's just more, and that differs from dentist to dentist. I know I've got one friend who is a periodontist. He brings every patient back for a follow-up,
right?
And then others don't.
So go ahead, Walter.
Sorry. So for surgeries, if it was a big case, if it was just like, okay, suture removal, I trust that the general dentist will do the suture removal. that's not a big deal, you know. And then like, so for example, if it was like an implant that I placed, I put the tissue back, they need to do is just remove the suture. I just basically say, hey, can you take the suture out? Most general dentists or referring doctors have no problems with that at all. If they do, I mean, it takes like 2 seconds. I look at that area and then that's it, right? I bring them back a month later just to see how they're doing and if there's any issues at all. You know, patients have direct access to me, meaning through my cell phone, and they usually call or text me. And so I'm getting text messages or calls throughout the day. You know, hey, Dr. Ock, is this normal? What's going on? And as they describe it to me, and again, this is probably when telemedicine, now that I understand it a little bit better, will come in handy. As they describe it to me or send me pictures, then I'm actually able to tell them, don't worry about it, or you need to come back in to see me so I can figure out what's going on.
As for me, like I keep my all my treatments are supposed to be on a year recall, but I go to 12 different offices, so I leave that up to the office to get that arranged. And like they don't have my schedule from a year from now, so like some patients do probably fall through the cracks. If it was my own office, then I'd have my front desk staff make sure that all those people were getting called every year to check that. But other than that, the only time I will ever see a patient before then is if there is some issue that's not resolving. A lot of time, like the occlusion's high on the crown, or
Open
they're having
margin.
cold sensitivity from another tooth, and it's not the same tooth. But yeah, just if there's like some unresolved issue, the patient needs to come back.
What do you? This may be more for you, Gary and Kyle. So for patients with acute abscesses, like severe swelling, what kind of follow-up, whether you're treating them or putting them on an antibiotic? Because it's always something like I see them, I'm like, I saw one on Friday, and he like lived quite a ways away, and it just wasn't going to happen that he was going to get to the emergent or the oral surgeon, and probably wasn't going to go to the emergency room. So I sent him clindamycin, and you just kind of hope that it resolves. But
Kyle,
do you do any sort of follow-up?
If it's on a weekend, if somebody calls me Friday when I'm out at the office with an acute swelling, that is a patient of record, I will send them in the antibiotic, and I will tell them, call the office Monday morning. We'll get you in, figure out what's going on with you. And then whenever I make a little note in my phone who it is, and I'll tell the front desk, reach out to this patient, make sure they're following up. If it's something where they're in the office and I'm doing the extraction or the root canal, and it's something that I'm concerned about, pre-COVID, all my extractions, no matter how small, I put stitches in everybody for any extraction. I always had a 1 week post-op for any extraction. Most of the time, I'm not even seeing those patients. That's something I'm delegating out to the dental assistant. Quick, 5-minute check, peek your head in, everything's doing great, and most of the time I don't have to. So there is follow-up that I do, but it's a little bit easier because it's they're used to coming into the general dentist office, so I can handle that stuff.
Are you still doing those follow-ups now? You're using resorbable sutures?
Yes, yeah. So I'm not scheduling the 1 week follow-ups anymore to try and limit that patient time in the office. Now I let them know if at any point you think there is a problem, something's continuing to bother you, stitches aren't coming out for whatever reason, which is never the case because they're resorbable, mainly lingering pain, infection. If anything feels sharp, if a little bone chip or something's coming out, give me a call anytime. I'll get you back in to look at it. So because of COVID, those follow-ups aren't happening quite as much.
Yeah, I think that's an instance where like teledentistry, or just using some other way to communicate with the patient, where you can, because even though you weren't seeing those patients, you were using PPE,
Right.
Chairs were occupied, assistants. And so, yeah, maybe you're just sending them a message to reach out and say, hey, if you do need me, let me know here. If you have concerns, you can snap a photo, or maybe you do it more like, yeah, I do want to follow up in a week. I guess you can assume if they don't respond, then you're good. But they do. So I think it's a lot of instances, it's a way that you're not producing more. Maybe you're saving some money, but you also are potentially adding another level of like customer service, patient experience that isn't costing you much or in some instances anything in time. There's also like, this is probably more you, Kyle, but how many times do you get a call where you see on the schedule it's a 10 or 11-year-old that, quote unquote, broke off their tooth, but the root's still in there. Probably 50, 75% of the time it's just the normal exfoliation. It's the adult tooth. Or, I bring denture patients back, routine, a week after insertion, but there's a portion of those times in which they come in, they sit down, they say, everything feels great. This is not their first set of dentures, so they kind of know. And so sometimes I don't even take a look.
See, there's an easy fix to those denture patient adjustments is you just don't do dentures. So I don't do dentures, so I don't have to worry about adjustments.
Don't ever ask Kyle for consultation. He's very useless to you.
So I think benefits wise, it's HIPAA compliant. It's easier, if it's done right to document. You're capturing records that you probably should be capturing now, but aren't. It reduces some of the back and forth through the front desk. And some people, they want to talk to the patient themselves. But if you're, there's a lot of times the front desk takes a message and then you want to know, well, is there swelling or are they taking the medications? And then like you either have to call them or the front desk calls them and asks the questions and then it relays you the message. And I think it can give them a better patient experience, better access to the dentist. It can reduce some non-billable visits. I think it saves the patient, a lot of time driving, time off work, childcare issues, especially with like COVID, these restrictions of not bringing more people to the appointment. I think those are, more top of mind. It's harder to figure out how to get in to have a follow-up, especially if they're not going to do anything and you've got kids at home that typically weren't at home because now they're home, virtual learning. It's going to give you some more information after hours for emergencies, hopefully help the front desk better schedule emergencies, give you some work that you can do in free time that maybe you weren't able to be productive at all. And then I think it also hopefully would help the front desk job be a little easier in terms of onboarding new patients and being on the phone, automating some of those like triage questions, getting patient information if you can have that in like a survey or a form or something that the patient's filling out on their own time. But there's also a lot of limitations. You're not going to be able to assess everything. You're not going to have radiographs. A lot of these patients, unless you already have it, and you may just have to bring the patient back into the office, and that's not like necessarily a failure of teledentistry. It's going to work really well in some instances. It's not going to work in other instances, but you still have what you're already doing to use in those instances. It's going to be limited by the user friendliness of the technology, especially with like less tech savvy patients. Limited by what insurances are going to reimburse, but that's hopefully changing. Going in the right direction. You're limited by the quality of photos. But I think I tested out an intraoral camera that we have in the office a few weeks ago versus just like my iPhone. And the iPhone blew away, I was able to capture in one photo what I would have taken a lot of photos intraorally with better quality. So one of the advantages of if you're using, photos that the patient takes is you've got these trillion-dollar companies that are like working on improving your cameras, the equipment, quote, quote, that you're using with patients. And so it's nice to kind of reap those benefits because you can take some really good photos, but again, it depends on how, limited by the patient's ability. And, I think there are also just trade-offs in, what you're going to be able to assess, especially in some of these models where if you're having like a hygienist go into schools or a nursing home, I still have concerns about, I'm a perfectionist, and so I really try to be thorough on exams. And I also see some pretty complex mouths. And so you're going to be limited by how good that hygienist is. You're not going to be able to see or feel as much if you're using that type of model. But I think in some instances, you could make an argument that that's a worthwhile trade-off if the alternative is, if you're really in a remote area where these kids just aren't going to be at a dentist otherwise, or that these nursing home patients wouldn't. So I think in some instances, to be honest, there are going to be some trade-offs on certain modalities. But you also have to, I think as dentists, we kind of just focus on like clinical perfection, and we don't necessarily think about the trade-offs in terms of like driving time and time off work and whether the patient's going to be seen otherwise. And so, I think you have to see a more holistic picture, but that is still a concern, that I have in certain instances. And then you're also going to be limited by laws, which is I wanted to ask about Texas, because I did some searching because I had heard that it was illegal in Texas or not legal in Texas. So this is what I found. This was earlier last year, I think it was like April and May, that the Texas State Board said, quote, additionally, the Texas State Board of Dental Examiners has received several questions related to teledentistry. Dentists in Texas are not authorized to practice teledentistry because of established legal requirements, such as Rule 108.8C2C, which requires, quote, documentation of the findings of a tactile and visual examination of the soft and hard tissues of the oral cavity, end quote. Remember, teledentistry is regulated by state statute and board rule, not associational recommendations. Please note, Texas currently does not have any rules that would permit teledentistry, which is kind of crazy because, like, can you not call in a prescription to a patient?
Well, so the e-prescription kind of eliminated that. But, I actually remember reading that email and just going, okay, well, now this is something I'm definitely not going to do. But I will say, though, one thing that I think, we can all sit here and talk about how great it is for patients and so forth, but dentists focus a lot on ROI, right? Like, if I'm going to implement this, how is it going to be beneficial for my practice, right? How am I going to financially benefit from this? And I think that's something that you have to lead with, right? No dentist is going to buy a CBCT if they're not going to reap the benefits of it, including charging other dentists to get a CBCT taken in their office. So that's something that I think you have to kind of say the dentists focus a lot more on return on investment than anything else when it comes to dentistry in general.
Yeah,
I'm thinking in the future. Let's consider the government as our friend and trust us to do our job, which is way out there. So let's take out laws.
Yes.
Let's take out the cost. Because I'm thinking in my head, they have the Da Vinci robots in medicine right now, where the surgeon is somewhere else and they remote in, and the surgeon is just sitting on a computer guiding this robot to do the surgery, and he has a support staff that's monitoring everything live and in person, doing everything they need to. In dentistry, they have, I forget the name of it, but they have the robotic arm now that will place the implants.
Oh yeah, yep. Mm-hmm.
So somebody has to physically touch the arm so it's so it works, but that level of technology is coming to dentistry. And I see, if it was available, I see this as something Gary would do, because he could just sit at home and not interact with anybody in his spacesuit, and he could be completely sterile and not worry about it. It would save all of our backs. The ergonomics would be good, but I'm thinking access to care in small towns, in areas where there isn't a dentist for 50, 100 miles, setting up a mobile clinic in a motorhome. They have mobile clinics out there now driving around, but having a support staff, if cost isn't an issue and you have something where you have a team that can get the records that you need, somebody that can anesthetize the patient, line them up, and Gary's sitting at home and he's just doing root canal after root canal through virtually with a Da Vinci type robot. Uh, Again, there's a lot of what ifs with cost, with government allowing us to do different things. But in an ideal world, I think that would be extremely beneficial to increase the access to care. And when patients can't make that 50, 100-mile or more drive to see a provider.
I would love to live in that world too, Kyle.
So,
Guess,
yeah,
like,
speaking
playing
of the
Halo?
future,
Yeah, you're playing video games.
so I did want to ask, so like the future of dentistry, I think, I think there's going to be more reimbursement for this from insurances, and that it's not going to be like, the term teledentistry is probably going to fade, and it's just going to be like doing smart dentistry, just doing dentistry. But I wanted to ask, so Walter and Kyle, Walter, you worked at Aspen, Kyle, you worked with Heartland.
Mm-hmm.
I don't know a lot about DSOs or corporate dentistry, but I would imagine that, with the trend of like the commoditization of dentistry, I could see, and correct me if I'm wrong, like wouldn't a DSO or corporate dentistry, if they can attract more patients, adopting something like this, and then I think at that point it's just going to be everybody else is kind of catching up to, catch up with what patients are expecting. As like, what, you can't text your dentist, or you can't like schedule a patient or an appointment online, or because I bought a car recently, and I don't know how much of this is COVID or how much of this is just like 2021, but I did most of it like via text and getting photos from the salesperson, and every website pretty much like have a little chat thing to pop up, or you can text the salesperson. So that seems to be like the standard amongst buying cars. I just would.
And they have car vending. They have car vending machines now. The Carvana or something.
Carvana.
You pick what you want, Vroom, and you go pick it up at the vending machine.
Yeah.
I'm a dinosaur, because there is no way I would ever buy a car that way.
Well, you can with Carvana, you can actually test drive it for 24 hours.
Well, I bought a car in Pennsylvania, and so this was like a 2-hour drive. So I didn't want to go down there to look at the car and then come back. So I got everything that I could. Again, kind of like teledentistry. Like I still had to go there, but I got photos of it. I asked, details. She took me photos of like, it was a truck I was buying, so I wanted to know like the payload capacity, everything. So I got as much as I could up front so that I knew that I wasn't going to waste a trip.
Right. I will say that DSOs will be big on, because they're very big on how do we bring as many patients in as possible. That's the key. They're big on, hey, how many, it's not even, sometimes it's not like, is this patient beneficial for productivity? It's just, we have a body in the chair. So that's basically, they're gonna eat it up, because it's more of like, oh, look, we're getting more patients. It may not be useful to the dentist, but they're getting more patients. And that's something
I currently work for 2 DSOs, and when COVID hit, like if it was March 15th, on March 20th, all of DSOs were pushing teledentistry. Like it was like they already had the platform. Like they were just waiting for the day. They're like, oh, this is the day. We're starting. Like all of them were pushing teledentistry.
Yeah.
And they have the people power to do it. Me as an independent provider, I am busy, 6 a.m. till 6 p.m. just doing regular dentistry and running the business to try and implement teledentistry, figure out which platform I want to use, how to incorporate it into my system, and figure out all the logistics of it. What happens when something goes wrong? That becomes a major issue with anything that I implement. With DSOs, look at their call centers. They have, you can call a DSO 24/7 and somebody's always going to answer that phone call. They have an accounting department. They have an insurance department. They have all kind of different areas that they have that support already built in, so they can incorporate these things and make it a very efficient thing to implement. Where if there's software that is trying to be developed for the independent practitioner, it has to have that same amount of ease of implementing something, where it's not taking a lot of time out of my life or my schedule to manage what is going on with it.
Right, and that's what I was saying about how we could just basically automatically transport everything that we do into the patient's schedule or into the patient's chart without having to double click or write another note or anything like that at all.
I think you mentioned call centers too. Like, yeah, I mean, I would imagine it's only a matter of time before, especially if insurances are reimbursing for this, where you have a call center of like dentists where, multiple offices, they're able to do some of these limited exams or triaging, and then, put that patient right into the schedule of, the local office. But yeah, interesting to hear your guys' thoughts, because I don't have, that experience with DSOs or corporate dentistry.
I have a quick question that's off topic. CDC, do they know what they're doing, or do they not know what they're doing?
What?
The CDC.
That has nothing to do with teledentistry, Gary. Literally, absolutely nothing to do with teledentistry.
I just said it was off topic.
No, it was completely off topic. It has nothing to do with teledentistry at all.
I prefaced.
Okay. Well, we're going to transition that into the next podcast. Can we do that, Gary?
Yes, we can do that.
Let's do that. Okay. I apologize.
Is there anything that you didn't cover that you wanted to, Gabe?
Yeah.
So yeah, I think this is going to be, just become what dentistry is. And I think some people may be playing catch up, especially depending on when DSOs, corporate dentistry, kind of catches on. And I think there's going to be like more innovative uses too, where, instead of maybe taking your own call, if you can use a service, there's obviously services already out there. But I think I'd feel a little more comfortable using a service if I knew that they were going to get a photo of what's going on, and be able to manage it that way. And then I would also get that record, when I came back in Monday. I think something like second opinions too. I think that would really shake up dentistry if now, I don't know about you guys, but like I've multiple family members have reached out to me, or friends, and say, hey, I just went to a new dentist. I'm told I need all these restorations. Like, I got my x-rays. And I look at them, and more often than not, I'm like, you should probably find a new dentist. But I mean, if there is that, again, it kind of goes in, plays into the commoditization of dentistry. But in some ways, I think if you can empower patients, I think that has some power to reform dentistry so that, people are more informed, and those that are doing good treatment, ethical treatment, are going to kind of rise to the top too. So I think there's a lot of interesting ways that it's going to be used in the future.
Well, thank you so much for coming on the show and educating everybody about what the possibilities are. And like we said earlier, congratulations for changing Gary's mind on something that's never been done before.
Not on here anyway.
I have an off-topic question for Gary. So when you're at the grocery store, like why don't you just wear multiple gloves on top? Just like,
that's a good idea.
So that's a good question. That's a good question.
Great idea.
Because I wear medium gloves, right? Okay. And the medium, like really my hand is like in between a medium and a large.
Okay.
Right? But I only buy medium gloves. So if I had multiple gloves on, they probably won't fit and they might rip. So then you're like, I'm just wasting the glove.
Buy a box of large though, like a couple mediums, then a couple larges.
Well, see, I don't like the large. I could do that, but I don't like the large because it's slightly too big, and then I don't get the.
But if that's like the fourth, or fifth one, it'll fit perfectly.
True, but the other thing is that
we're trying to solve your problem, Gary.
But see, like the fourth and fifth glove, those are just extra, because really I can do everything with like 3 gloves.
But you said 5 on the podcast.
I bring 5 in case I rip a glove, or I'm unable to put the same glove back on.
Gabe, do you see how crazy he is?
Well, it's funny because I don't know if it's this podcast or another one, but up until like probably 2 or 3 weeks ago, I was wiping down my groceries too, and it was like a kind of a momentous point where I'm like, okay,
Kindred
I'm gonna move on
spirits.
from this stage of COVID, because for the last little while I was like, it's probably not doing anything to like change my risk level.
But it's not
it was
about
also
COVID.
sort of like it was also kind of like an emotional like comfort blanket for me that it just made me feel better, even though
Of course.
it wasn't really doing anything. But it just became too much. So.
Well, Gary, comfort blanket.
It is.
Comfort
But
blanket.
the comfort, it's not initially. Yes, you start doing it because of the COVID, but then you're like, look at all this dirt that's on here.
True.
So that's why I have continued to do it. It's not about COVID. It's about like getting all the dirt off.
Hypochondriacs do the same thing.
But then here's a question: then you put it in your pantry, and it collects dust because you haven't used it for like 2 weeks. What do you do with that?
Why would you buy a bunch of food that you're not going to use for 2 weeks?
It's called a canned food. They last for a long time.
I mean, are you doomsday prepping?
You are. I know that. I'm trying to go with everything that's been going on.
Well, it's my dust. It's my dust. That's the difference.
It's my dust. Got you.
It's my skin cells. It's my hair.
We're gonna end on Gary's dust. It's Gary's dust. That's way better. Hey, Gabe, thank you so much for coming on, man.
Yes, thanks for having me.
I learned a lot. I really learned a lot today, so that was pretty cool.
Yeah, thanks.
All right, guys.
All right, guys.
All right.
Yep,
cool.
we're good.
All right.